Hello everyone, my name is Cuadros and I'm an associate professor and the director of the Digital Epidemiology Laboratory at the University of Cincinnati. I'm going to summarize the article titled Assessing Access to Digital Services in Healthcare Underserved Communities in the United States. So this is a cross-sectional study that is going to be published in the Mayo Clinic Proceedings Digital Health. So the motivation for this study was the rapid development of new digital technologies that were focusing on healthcare and that were also boosted by the needs that we endured during the peak of the current COVID-19 pandemic. But several recent studies have highlighted concerns that increased telehealth coverage can actually worsen the persisting healthcare disparities among certain populations. So that's why we think that it's very critical to identify the barriers to telehealth use and also develop solutions to overcome those barriers to meet the needs for the most vulnerable communities. And that's why we conducted this data visualization and spatial analysis to assess the geospatial association between digital disparities and healthcare underserved communities in the United States at county level. So in this study, we found a negative geospatial correlation between internet broadband coverage and the healthcare capacity and infrastructure in the country. So we found that counties with lower internet broadband access are having higher social and healthcare vulnerability indexes. So basically, counties with the lowest broadband access were actually also counties with the highest healthcare resource constraint. Also, they have the bigger barriers to healthcare access and also the highest social vulnerability indexes. So basically, our study identified that the most healthcare underserved communities in the country are also located in digital deserts with low, high-speed internet access. So those digital barriers could prevent the successful expansion of digital healthcare services and also could exacerbate healthcare disparities in those vulnerable communities in the United States. So those findings have important implications for clinical practitioners because it highlights the impact of disparities in broadband access on healthcare. So basically, that's why healthcare providers need to be aware of those disparities and consider alternative methods to reach and serve patients who are actually located in these digital underserved communities. Also for patients, it's very important. The findings that we're describing in this article is very important because those emphasize the role that broadband access are going to play in accessing healthcare services. So those patients that are in those areas with low broadband access that are located in those digital deserts are going to face bigger challenges in obtaining timely and convenient healthcare access. So this could lead to potential delays in diagnosis, in treatment, and overall healthcare outcomes. These results underscore the need for policymakers and healthcare leaders to prioritize efforts to improve broadband infrastructure, to increase digital literacy, and also to increase affordability to ensure equitable access to healthcare services for all patients and all communities. So the next steps for this kind of research could involve the further investigation of the specific factors that are driving this digital divide in healthcare access. So we could include, for example, exploring the relationship between broadband access and healthcare outcomes, also evaluate the effectiveness of interventions that are allocated to reduce the digital divide, and also identify strategies to improve digital literacy and increase access in those vulnerable communities. Thank you.